Hey there, health warriors! Have you ever cared for someone who seemed confused, forgetful, or had trouble recognizing people they once knew well? You may have encountered a patient living with Alzheimer's disease or another form of dementia. Today, we're giving healthcare workers a clear, compassionate introduction to Alzheimer's and dementia, what these conditions are, how they affect patients, and how to provide safe, respectful, and person-centered care. Let's begin. Dementia is a general term that describes a decline in cognitive abilities, thinking, remembering, reasoning, and behavior that's severe enough to interfere with daily life. Alzheimer's disease is the most common form of dementia, accounting for 60 to 80% of cases. Other types include vascular dementia, which is due to strokes or poor blood flow to the brain, Lewy body dementia, and frontotemporal dementia. While dementia is more common in older adults, it is not a normal part of aging. Common signs of dementia include short-term memory loss, repeating questions or stories, difficulty with familiar tasks like using a microwave or paying bills, language problems or word-finding difficulty, confusion about time or place, mood or personality changes, and poor judgment and decision-making. Symptoms are progressive, starting mildly and worsening over time. Early recognition allows for better planning and support. Alzheimer's disease causes damage to brain cells through the buildup of amyloid plaques, which are abnormal protein clusters, and neurofibrillary tangles, which are twisted strands inside brain cells. These lead to shrinking brain tissue, loss of communication between neurons, and a gradual decline in cognitive and physical function. Over time, the brain physically deteriorates, affecting memory, mobility, and even basic functions like swallowing. So, how to support patients with dementia? Use clear, simple communication. Speak slowly and calmly. Use short sentences. Avoid arguing or correcting, redirect instead. Maintain a calm, consistent environment. Reduce noise and clutter. Keep routines predictable. Use visual cues and clocks to aid orientation. Approach with empathy and patience. Always introduce yourself. Approach from the front, never startle. Smile, make eye contact, and use gentle touch when appropriate. Focus on abilities, not just decline. Encourage independence in daily activities when possible. Provide meaningful engagement like music, simple tasks, and conversation. Validate feelings even if they don't make sense logically. Involve family and interdisciplinary teams. Coordinate with caregivers, social workers, therapists, and physicians. Keep care plans updated as symptoms progress. A little understanding goes a long way in preserving dignity and quality of life. Here are some safety considerations in dementia care. Prevent wandering, use bed or chair alarms or secure units. For fall precautions, keep floors clear and ensure good lighting. Manage medication carefully. Watch for confusion or refusal. Monitor nutrition and hydration. Keep an eye on intake and swallowing ability. Recognize when palliative support is needed for end-of-life care. Dementia care is about meeting patients where they are, not where we wish they were. Caring for someone with Alzheimer's or dementia isn't just about tasks. It's about connection, patience, and respect. As healthcare workers, your role in these patients' lives is powerful. With the right knowledge and approach, you can make every interaction more meaningful and every day more comfortable. Have you worked with dementia patients or caregivers? Share your experience or tips in the comments below. We can all learn from each other. Like this video? Give it a thumbs up. Subscribe for more healthcare training, communication, and patient-centered care strategies. And remember, dementia care with heart, knowledge, compassion, dignity,